For the current moment, that is the correct advice. What we are telling women who are pregnant is that they are at risk of contracting the Zika virus if they visited the affected countries, which are largely northern parts of South America and southern parts of Central America. And we would advise them to avoid travel to those areas if possible.
And if it isn't possible, what should they do? Are there any precautions they can take?
I think the first important thing they need to do is to discuss the matter with their doctor or the antenatal clinic to make sure that they're aware. And whilst they are in these parts, take strenuous efforts to avoid being bitten by mosquitoes. And that includes using mosquito repellents and sleeping within nets and all the other things. And when they come back, within the first 2 weeks of their return, should they experience any symptoms, then to contact their doctor and let them know.
I suppose it's important to see this in context because something like 80% of people that contract the virus actually don't show any symptoms.
Yes, it is an odd disease because it's quite mild, really. And 80% of the people don't get any symptoms at all. 20% get a mild illness. So it isn't something that we would even ordinarily worry about, were it not for the fact that it somehow seems to slip through the placental barrier in pregnant women and cause birth defects to babies. And because that is something that we really don't want to have, we need to just sit up and take notice about this disease.
Of course, I think it's important also to reassure the public that there haven't been any cases in Gibraltar and that the mosquito that transmits this virus is not indigenous to Gibraltar or to Europe, so the chances of getting it if you haven't been to South America are really almost non-existent.
Yes, quite. The mosquito, as you said, does not exist. It's a particular mosquito called the Aedes aegypti that doesn't exist. There is a variant of that, a similar kind of mosquito that does exist in southern Spain, and we're trying to see if there's any relative of that anywhere here in Gibraltar. But having said that, the virus doesn't exist here either. So it would need someone to bring the virus from abroad and then be bitten by the mosquito within a very short period, and then that mosquito transmit it to somebody else who is pregnant. It is quite far-fetched. So I don't think the public need to worry about this to any extent. These are just precautions that we are advising to people who might want to go there.
Also, the disease isn't transmittable from person to person. Is that right?
That's right. This disease does not transmit from person to person.
Do we know why it is that this has happened now, or has it always happened? I'd never actually heard of the Zika virus until now. Is this development of it affecting pregnant women and babies a new development, or has it always been the case?
The Zika virus has been there for quite a few years. And in fact, it has existed in several parts of the world, including Thailand and South America and so on. But this association with birth defects is something new that has not been catalogued. And it wouldn't have come to light were it not for the fact that a very large number of such birth defects, I think well over 3,000 cases, have come to light due to this large outbreak.
So this is something that the scientific community will be keeping a close eye on?
Oh yes, there's quite a lot of activity. The World Health Organization is very active in this, and there are lots of teams from the United States and other parts of America converging on the area to catalogue the illness.